Welcome back to Stroke Academy. Today, I want to talk about something that's been on my mind for a while now. Something I see playing out every single day in my clinic. And honestly, it's something every doctor needs to hear. We are living through a transformation in medicine, a real one. Not the kind people talk about at conferences and then forget. This one is actually happening. So let me take you back a little. I started my neurology practice in 1996. That's what? Almost 30 years ago now. And in those early years, patients came to you, sat across from you, and they listened. There weren't many specialists around. Whatever you said was, for the most part, accepted, followed. That was the relationship. Then, somewhere in the next decade, things started shifting. Patients began coming in with printouts, Google searches, a cousin who had seen a different doctor in another city. It became the era of opinions, second opinions, third opinions. People were comparing, validating, sometimes even testing us a little, which, honestly, isn't entirely a bad thing. But lately, and this is what really caught my attention, patients aren't just asking for opinions anymore. They're asking for suggestions. And the first time someone said that to me, I stopped. I actually paused mid-sentence. Why suggestions? I thought. That's an odd word to use with your neurologist. Then it hit me. There's a new participant in the consultation room, one who isn't physically present but is very much there. Patients today are walking in after conversations with ChatGPT, Gemini, Perplexity, Claude, these AI tools. And these tools are not just throwing raw medical information at them, they're explaining things clearly, conversationally, in the patient's own language, at 2 in the morning, in the comfort of their home, with no waiting room and no appointment needed. So when they come to me, they've already had a conversation, they've already formed some understanding, and now they want my take on it. That's why they say suggestions. And here's the thing, and I say this as someone who spent decades building expertise. Doctors were once the sole custodians of medical knowledge. That has changed. Knowledge today is democratized, accessible, personalized. It meets people where they are. Sorry about that. Now, is this a threat? Some of my colleagues certainly feel that way. I understand the anxiety. But I'd push back on that framing. This isn't just a technological shift. This is a cultural transformation. And that's what real digital transformation looks like. It doesn't just change tools, it changes relationships. Our job now is not to compete with AI. That would be like a teacher being threatened by a library. Our job is to work alongside it, to provide the one thing no algorithm can: context, judgment, accountability, and the human weight of being truly responsible for another person's well-being. That is where our relevance lies. Okay, that's enough for today's episode. In the next one, we'll get practical. How do we as doctors stay relevant and lead in this era of artificial intelligence? What do we actually do? We'll get into that. If you found this useful, please subscribe, and more importantly, share it with a colleague. These are conversations our community needs to be having. Thank you for watching. Take care of yourselves.